Okay, today we are diving deep into Montelukast. You might know it by its brand name, Singulair. It's an incredibly common prescription for asthma and allergies, and for millions of people, it's a total game changer for breathing easier. But, and this is a big but, there's a really serious side to this drug that, frankly, everyone needs to know about, especially if you or someone in your family takes it.
And that's really the core question here, isn't it? How can a daily pill that helps so many people breathe freely also carry one of the scariest warnings the FDA puts on a drug? It's a paradox. So we're going to unpack the whole thing, the science, why it works so well, and the risk you absolutely have to understand.
All right, first things first. What exactly is Montelukast? Before we can even get to the risks, we got to understand what it's designed to do and, importantly, what it's not designed to do. So a couple of key things here. First, it's a non-steroid. That's a big deal because a lot of asthma meds are steroids. It belongs to this class of drugs called, get ready for it, Leukotriene Receptor antagonists. Yeah, it's a mouthful. Just call them LTRAs. But here's the most important takeaway. It's a maintenance drug. You take it every single day to prevent symptoms before they even start. It is absolutely 100% not a rescue inhaler you'd use for a sudden asthma attack. Okay, so how does this one little pill manage to stop symptoms before they even get going? Well, the way it works is actually pretty clever, almost like a simple key and a lock. And to get it, we first have to introduce the villains of the story. And here they are, leukotrienes. So picture this. Your body comes across something it doesn't like. Pollen, cat dander, dust, whatever. Your immune system freaks out a little and unleashes these chemicals, the leukotrienes. They're basically the body's emergency response team, but they kind of overdo it. They're the ones that cause all the misery. Your airways clamp down, everything gets swollen and inflamed, and you get all that gross mucus. Yeah, you can thank the leukotrienes for that. Then this is where the magic happens. It's a super simple analogy. Think of those leukotrienes as little keys, and all over your airways you have these special receptors, which are like tiny locks. When the leukotriene key fits into the receptor lock, bam! Inflammation gets triggered. So what does Montelukast do? It's basically a blocker. It swoops in and plugs up the lock before the key can get there. The leukotriene shows up, tries to get in, but the door's already blocked. No key in the lock means no inflammation, no tight airways, no mucus. It's simple, right? But it's also really, really effective.
So now that we know how it works by blocking those pathways, who is this drug actually prescribed to? Let's take a look at the 3 main reasons a doctor might give you a script for it.
Okay, so the FDA has given it the green light for 3 specific things. First up is good old asthma, the chronic, long-term prevention of it. And what's interesting is it's approved for kids as young as 1 year old. Second, for allergic rhinitis, which is just the fancy term for seasonal allergies or indoor allergies, pollen, dust mites, all that fun stuff. And finally, it's used to prevent exercise-induced bronchoconstriction, or EIB. That's when working out makes it hard to breathe, and that's approved for people 6 and up. So you can see it covers a pretty wide range of issues.
Okay, I know we've already hit this point, but it's so unbelievably important that we have to say it again. I want this to be crystal clear. This drug will do absolutely nothing to stop an asthma attack that's already happening. For that, you need your fast-acting rescue inhaler. Montelukast is for one thing and one thing only: prevention.
And this is the most critical part of our entire conversation. This is the whole reason we're doing this explainer. Because for all its benefits, this medication comes with a massive catch, a really, really serious one. So this isn't some minor side effect you find buried in the fine print. Back in 2020, the FDA took a huge step and slapped what's called a boxed warning on Montelukast. You might have heard it called a black box warning. Let me be clear, this is the most serious warning the FDA can issue. It's reserved for drugs that carry significant risks of serious or even life-threatening adverse effects. It's a huge red flag. So what is this warning for? It's for serious neuropsychiatric events, and that's a clinical term for some really scary changes in mental health. We're talking about major shifts in mood, like depression and anxiety, changes in behavior, like becoming agitated, aggressive, or even hostile. And this is the most serious one. It's been linked to suicidal thoughts and even actions. It can also wreak havoc on sleep, causing insomnia, night terrors, and incredibly vivid nightmares. And this isn't just in adults. These things have been reported in patients of all ages, even very young children. So the bottom line, the absolute most important action item from all of this is right here. If you or your child or anyone you know is on this medication and you see any of these changes, any shift in mood, any weird behavior, anything that seems off, the official FDA guidance is clear. Stop taking the drug and call a doctor right away. Don't wait. Don't second guess yourself. Call the doctor. Okay, I know that was a lot to take in, and it's some pretty heavy stuff, but it's so, so important. So let's just boil it all down to the 3 key things you absolutely have to remember.
All right, here are the 3 big takeaways. Number 1, it's a preventer, a daily pill to stop attacks before they start, not a rescue inhaler for when you're already in trouble. Number 2, it works by blocking inflammation. It physically gets in the way of those pesky leukotrienes. And number 3, the most important one by far, watch for the warnings. This drug has the FDA's biggest, baddest warning label for a reason. You have to be vigilant about any changes in mood or behavior.
Which really brings us to the final tough question. When you have a drug that offers real, tangible benefits, but also comes with these kinds of serious risks, how do you make the best choice for yourself or your family? Well, our job isn't to give you that answer. Our job is to make sure you have all the information, the full story. The goal here was to empower you, so you can walk into your doctor's office and have a truly informed conversation to make the right call for your health.